everybody, all of us, myself included, we want to get out. We want to see people again. But that's why we need our government to act quickly and effectively to shorten this pain as much as they can.
Hello and welcome to GZERO World. I'm Ian Bremmer. And as we enter the dog days of summer amid a pandemic, there are still so many questions about what awaits us this fall. Will schools reopen safely? And how does America get back to work without drowning in a second wave? Well, we're still in the first. My guest is former Surgeon General Vivek Murthy. We're also talking about another pandemic, one he believes is just as serious, loneliness, and how quarantine and social distancing are impacting mental health in the United States and around the world. People tend to think in threes: blood, sweat, and tears. Sex, drugs, and rock and roll. Moe, Larry, and Curly. It's no different when it comes to bad news. If recent history is a trinity, Europe is now facing its unholy ghost. Its leadership. Having already stared down two prior crises in just over a decade, you had the 2008 financial meltdown and the 2015 migrant crisis, the pandemic is, without question, the most severe of those three. But the way it's been handled in some European countries where public health guidelines were followed and science eclipsed politics is markedly different than in much of the United States. The EU and the United States have comparable populations, and since April, the average 3-day count of new European deaths fell by 97%. In the United States, that figure dropped by only 2/3, with the epicenter of the global virus shifting to the Western Hemisphere. You might point to stricter social distancing and mask wearing in Europe as one reason, and you wouldn't be wrong. 78% of French residents now say they wear masks, 81% of Italians, 86% of Spaniards. In the US, it's just 71%, with local leaders in some areas still actively discouraging the practice. But that's not the full story. And Europe doesn't speak with one voice. In Sweden, where the mortality rate is nearly a third higher than in the United States, just 5% of Swedes say they cover their face in public. Too attractive, apparently. In Belarus, which is not an EU member, President Lukashenko has taken a different approach altogether.
Ну, я человек не пьющий, но в последнее время в шутку говорю, что водкой надо не только руки мыть, но, наверное, в день 40-50 грамм в пересчете на чистый спирт травить этот вирус.
Right. Next up, the social toll. As the months tick by under quarantine, pressure is building to get back to business, despite warnings of contagion.
All we have done is suppress the first wave, and when you take the brakes off, you would expect it to come back.
U.S. states have reopened only to close again when caseloads increase, whereas much of Europe has pursued a more phased approach. But it's hard. Social distancing butts up against human nature and tests our capacity for cooperation. The scientific community, meanwhile, is in no rush to return to normal.
Working from home for many companies remains a perfectly good option.
There's reason to listen. Countries like Germany, which focused on quick containment and widespread testing, have fared much better than the United States, where the nation's authority on infectious disease is fair game for political point scoring. Senior White House trade official Peter Navarro trashed Anthony Fauci in an opinion article in the USA Today, while the White House reportedly compiled a list of all the times Fauci had been wrong.
It is a bit bizarre. I don't really fully understand it.
President Trump has since distanced himself from such attacks.
We're all in the same team, including Dr. Fauci. I have a very good relationship with Dr. Fauci.
And top Republican leadership have recently also expressed their support.
What's your level of confidence in Dr. Fauci at this point?
Total.
It doesn't matter who you are or what you are. You're Republican, Democrat, anybody else. We're all in this together.
When it comes to the science itself, rarely has there been such a global focus on a common enemy. Just don't expect the politics to go away. How well a nation can separate the two may very well determine the next phase of this crisis. And to help us get a better handle on it, I sat down with a man who dealt with the spread of Ebola and Zika, all while holding a top administration post. Here's my interview with former Surgeon General of the United States and the youngest ever to hold the role, Dr. Vivek Murthy. Vivek, good to be with you.
Thanks for having me, Ian.
So you're in Miami now. Are you just following the epicenter of the epidemic? Because that's what you're sort of on about now?
Well, not intentionally, at least. Yeah, normally, my wife and our two kids, we live in Washington, D.C., but We came down to Miami in March, actually. This is where I grew up. So at the time, Miami wasn't so bad, but it's quite bad right now. And it's one of the epicenters in the country.
I mean, a lot of polarization around how Governor DeSantis is responding. I'm seeing that ICUs not far from you right now are overflow. How does it look?
Well, Florida is in bad shape. We are unfortunately seeing the numbers skyrocket here. And in particular, it's the test positivity rate, the percentage of tests performed that are positive, that is deeply concerning. You normally want that number to be below 5, but I'll tell you that where I am in Miami-Dade County right now is, as far as recently as a week ago, we had test positivity rates that surged above 30%. That's unheard of. That is an extraordinarily high number. And what that tells us is that the amount of infection in the community is quite significant and that it is in fact growing. So there are measures that have been taken in some counties. In Miami, for example, there is a mandatory mask order to wear masks in public. They've also taken some steps to close down bars and indoor restaurants. But those measures need to be taken across the country. And unfortunately, what we're seeing in the case of Florida is that we're still waiting too long here.
I mean, specifically, I remember in Lombardy in northern Italy, when the hospitals got overwhelmed, that's when mortality really spiked. Here in New York City, we came close to that, never quite hit. Is that a possibility in South Florida in the coming weeks?
Well, we certainly hope it won't get to that, but yes, that is a possibility. We have seen hospitals and ICUs fill up in many parts of Florida, including here in Miami, Florida. And there's a lag between these different events when it comes to COVID-19, and that's really important to understand. First, what happens is people go out and they get exposed. And then sometime after that, some period between 2 to 14 days, people will develop symptoms. And after that, they will go to get a test. They may have to wait several days, sometimes up to a week, to get the test results. Then we'll see ER visits and hospital stay rates go up. And then after that, a week or two after that, we will see death rates go up. So there is this long lag that happens. And even a few weeks ago, people were saying, oh, this isn't that serious because deaths are continuing to go down. But what many of us recognized and what had been talked about for weeks was that those deaths were going to go up. And that's what we're unfortunately seeing now.
We've had a number of days of well over 10,000 cases in Florida, which is a number of days of well over 100 deaths. But fortunately, that death rate is nowhere close to what we had in the New York City broader metro area. Is that largely because it's a much younger spread and you don't have, for example, the assisted living concerns that you did in New York? Is it because it's too early and you're likely to get the demographics going up? Are older people just being a hell of a lot more cautious because they know better at this point? What's your view?
Well, I think there are a few things that are going on in our favor. I think one is that there is more awareness that this is a serious issue and that it's particularly concerning for those who are elderly. And so I do think people who are older, many of them are taking more precautions than perhaps they were in March. I think we also know more about how to handle this virus when it comes into the hospital. We've recognized, for example, that using high flow oxygen as opposed to intubating early is a better strategy. We have dexamethasone, a steroid, which we now understand can be helpful for reducing mortality. We have remdesivir, which doesn't necessarily reduce mortality, but reduces hospital stay. So we do have a few more tools, nothing that's a game changer, but a few more tools. But my concern is the following. Unlike what happened in March in New York, we are now seeing rapid spread in many states. So not just a couple, but in Florida, Arizona, Texas, South Carolina, Southern California, and the list goes on. What we're also seeing is that even though there's a greater portion of young people who are affected now, and even though young people have fewer complications than older people, although not zero complications, that will ultimately, unfortunately, change because the more younger people get affected, the more older people they will expose.
A lot of substance there. I want to dig into a few different pieces. One, in terms of the tools, oxygen, at high density as opposed to ventilators. Knowing what we know now, if we had known that earlier, the effort to get thousands and thousands of ventilators manufactured and shipped, could that have all been avoided if we had just known how to treat this thing?
I don't think all of it could have been avoided because I think that it's still the case that ventilators are useful in certain circumstances. But what we've recognized is that if we use high flow oxygen earlier in the course of illness, we may be able to avoid intubation and needing a ventilator. But that will inevitably still be the case, that we will need that from time to time. So recognizing that we had a shortage and mobilizing those resources was not the wrong thing to do. Unfortunately, though, what I worry about, Ian, is that we're not still heeding many of the lessons that we learned from New York. What New York taught us is the following. It said that we've got to make sure that our hospital systems have the equipment, the materials, and the support in terms of person power to ensure that they can handle a surge. Today, we are still seeing hospital systems across the Sun Belt in the country that are struggling without protective equipment. We also learned from New York's experience that testing is critical. See, testing is like our eyes. It's what lets us see where the virus is. And if we can't see, we can't contain the virus. We can't contain it, it will continue to spread.
I have seen the Trump administration buying up almost 100% of the global distribution capacity of Remdesivir internationally for the next 6 months. If you were Surgeon General now, would you be recommending that that is the right course of action for the United States?
Well, I think that we have to put all of this in perspective and to recognize that Remdesivir, while it's an arrow in our quiver, it is not a game changer. It's not a silver bullet. And in fact, if you look at the data on Remdesivir, what it tells you is that it modestly reduces the time of hospitalization for people who are hospitalized and severely ill, right? That's actually a small minority of people. So is it useful? Yes. Does it make sense to make it the linchpin of our COVID-19 strategy and to make people think that because we have Remdesivir, somehow we've solved this problem? Absolutely not. What I would do instead is I would focus my efforts on, number one, reducing the amount of infection we have. And you do that by ensuring there's universal wearing of masks. You do that by reducing and pulling back on physical interactions. And you do that in part by also communicating effectively and with one voice consistently to the public about this illness. What we've seen, unfortunately, though, is that the communication has often been either misguided or conflicting. And so people have taken away different messages. We've also seen a response effort that has been unnecessarily politicized. And as a result, masks have become a political symbol, but whereas they're in fact a public health intervention that could save lives.
Now, well, let's get into that politicization and the mask wearing, because on the one hand, I mean, your successor, Jerome Adams, has been going public saying, please, I'm begging everybody, please wear a face covering. On the other hand, in early days, we saw the CDC, we saw the World Health Organization, we saw Dr. Fauci all saying that they weren't so sure about mask wearing. Some of that conservatism and concerns about Americans going and panic buying, and there wouldn't be enough masks available for frontline workers. I mean, you know, how do you balance that?
Listen, you have to remember in these kind of pandemics is that you are both trying to put an action plan in place while you're actively trying to learn about the virus at the same time. And sometimes that means that you're going to learn new things that change your guidance. But Ian, this is why it is absolutely essential that you communicate honestly, openly, and transparently throughout a pandemic response. Because what you are doing when you do that is you're doing more than giving information to people. You're building public trust. And it turns out that in a pandemic response, one of the most important assets you have is public trust. And if you allow it to fritter away because you either communicate inconsistently or you don't explain to people why you're recommending what you're recommending, then what you end up with is a situation where people are not only distrustful, but they may not do the things you advise them to, even though they're the right thing to do. And here's where I'm worried about it. Today, we know we are working on all fronts to develop a vaccine for COVID-19. Yet, recently, polls showed that nearly 50% of people, when asked if they would take that vaccine if it was available today, said no. Now, why is that? When we know how powerful the impact of this virus already has been economically in terms of our health, it's coming about because public trust, has been damaged. And so we've got to remember at all points when we communicate that it's okay to change your mind and your guidance as you learn things. That's going to happen. And it's going to happen that you're going to stumble, that you're going to make a mistake. What matters is how openly and honestly you're communicating with people, and are you learning from your stumbles? And that's really the key here.
Here in the United States, we have an election coming up in November. And, what happens if vaccines are sort of looking like they're promising, but they're not where you would suggest? But Trump, the president, comes out and says, well, yeah, we should make this vaccine work. It's successful. I mean, how do we avoid a whole bunch of people in the United States at that point saying, I don't know if I want to take this vaccine because I don't feel, never mind the anti-vaxxer movement, that's a different problem.
Yeah, and I think you raised a really good point, and it's a point I'm deeply concerned about as well. We already have enough challenges with people understanding and the science behind vaccines. We cannot afford to allow the development and approval of a vaccine to be further politicized. And what that means is that if we come to the point, which I hope we will as soon as possible, where we have enough evidence to support a vaccine as being both safe and effective, and what's got to happen is that we make that data readily available so that the public can see it as well, so that independent scientists can vet that data. And we also have to be very transparent about the process for issuing an approval, because the stakes are high here. The risk of getting that decision wrong and, God forbid, pushing forward an approval for political reasons could be disastrous. And that could damage trust in the vaccine development process for years and years to come. And that's much too high a price for us to pay.
And a vaccine, I mean, I'm hearing a lot of people saying that the first vaccines that work, if we're talking about, vaccines for flus, they're also not silver bullets, right? I mean, they don't get everybody. They're not successful in all cases. So even once you have distribution, it's not like suddenly everyone's back to work and it's fine.
That's right. And some of the things that we're trying to figure out now is what kind of vaccine we'll get at the end of this. We might get a vaccine that helps some people, but not many people. We might get a vaccine that requires a couple of doses to get you up to a protected level, which will make the logistics more complicated. We may get a vaccine that does pretty well, but the immunity only lasts for a year, in which case people need to get it every year. Only time and the science will tell us what kind of vaccine we end up with. But the good news is that we have a number of vaccine candidates that are actually in advanced stage trials right now. That's good. We have people all over the world in the public and private sector working together to develop this vaccine. And it's happening at a remarkable pace, in part because of this collaboration and in part because of technology we have now that we didn't have 5-10 years ago.
Now, I want to turn to the other side, because before the pandemic hit, you were making a name for yourself writing about the dangers of the loneliness pandemic, the mental health issues that were affecting all of these people in the United States and around the world because they weren't connected socially, because we were bowling alone, as Bob Putnam used to say in my field. I mean, now it's much worse, right? What do we do about this?
Well, I never imagined, when I wrote the book on loneliness, that this would be where we would be. Because even before COVID-19, we were actually struggling with extremely high levels of loneliness and disconnection in society, not just in the US, but in countries around the world. We have more people who admit to struggling with loneliness in America than have diabetes or who smoke. But the real concern here also is that it's not just a bad feeling, but we know that loneliness has health consequences, that people who struggle with loneliness are at increased risk for premature death, for heart disease, dementia, depression, anxiety, sleep disturbances, and the list goes on. So my worry with COVID-19 is that the physical separation that we've been asked to endure, the stress that so many people are under without the ability to get together with their close friends, that will take a toll on us mentally and psychologically. And in fact, for some people, and for many people, if we don't do something differently, that physical distancing will convert into social distancing, and a deeper loneliness that would essentially create, as I think of it, a social recession. And that I think could be just as consequential as the economic headwinds we may be facing. But I don't think that we're destined to go in that direction. I actually think we can choose a second path, which is not the path of social recession, but the path of social revival. If we can use COVID-19 as our opportunity to step back and take stock of our lives, to double down, in fact, on our commitment to the relationships in our lives, to double down on our commitment to people, then, in fact, I think we may be able to come out of this stronger than we were before. And we can do that in simple ways. We can, for example, make it a point to keep 15 minutes each day when we're actually connecting with people we care about. We can make it a point to seek out others with opportunities to serve and help them, recognizing everybody is suffering in this moment of upheaval, but also that service is one of the most powerful ways that we can help address loneliness. It's an antidote, if you will, to loneliness.
Dr. Vivek Murthy, our former Surgeon General, wonderful to be with you, sir.
Thanks so much, Ian. Great to be with you too.
That's our show this week. Come back next week. And if you like what you see, and of course you do, because otherwise why would you keep doing this every week, even under quarantine? Take a minute to sign up for GZERO's most excellent morning newsletter. It's called Signal.